Hi, my name is Teresa Palmer. I'm a family doctor, MD geriatrician. I worked at Laguna Honda from 1989 to 2004, and I left partly because of the admission policies that were creating an unsafe environment at Laguna Honda. I was shop steward of the doctors union at that time, and I knew about any incident that occurred, and I felt that management saw me in a whistleblower role, and that I couldn't continue there with peace of mind. I have three speakers. One of them is Pat McGinnis, who's head of California Advocates for Nursing Home Reform. And she has a comprehensive view of problems with licensure and human rights in nursing home. Derek Kerr will be the second speaker. He was a fellow employee at Laguna Honda and basically got run out for whistleblowing, but sued and won afterwards. And he ran a world-class hospice that was internationally recognized, but that wasn't enough to save him, since he wasn't a yes person at Laguna Honda. And last is Lakeitha Pierce, who works as a human rights organizer for the Coalition on Homelessness. And I wanted someone who can speak to what happens to people at Laguna Honda that come from or are discharged to a homeless shelter or to unstable or marginalized housing, and what the options are for people with mental illness and substance use, also known as dual diagnosis, in the city, who also have medical problems. And one of my feelings is one of the ways Laguna Honda got in this mess was because San Francisco didn't have adequate programming for these people and shoehorned them into Laguna Honda. Could you do the admitting, Art?
Yep.
And I learned today that there's 600 skilled nursing patients left at Laguna Honda. There's 120 that are managed by the public guardian, which means they have no families. And 2 of those who were discharged died within days of discharge. And the public guardian is very upset. This is called transfer trauma or relocation stress. There's a very good literature about what happens to nursing home patients that have to undergo relocation. There's a very high death rate. And there's a lot of obfuscation about what CMS is actually requiring. As far as I can tell, CMS, the feds, is not requiring that Laguna Honda be empty by mid-September. It's just saying that payment may stop. But it seems like the city having to pay for some of its most fragile patients might be better than killing them by transferring them. I feel that like Laguna Honda must stay open, that it must serve as many San Franciscans as possible that need it, that beds should not be cut, and that there needs to be an outcry. Much like we supported the proposition in 1999 to rebuild Laguna Honda, I think the public really needs to insist that Laguna Honda stay open, that the rights of the humans still at Laguna Honda be honored, and that CMS and CDPH and the city work constructively without hurting existing residents and without denying in-county nursing home beds to future residents. Okay, I'm going to stop now, and can I turn it over to you, Patricia? You're muted, hon.
I've been on Zoom all day. I don't know why I did that. You'll have to forgive me. I have a pretty bad cold right now, but I want to go through a little bit of what we learned today from all the bureaucrats, CMS, DPH, Department of Public Health in Sacramento. all of those folks, which was very disheartening in a way. And I also want to talk to you about what we plan to do and we, a little bit of hope.
Could you introduce yourself in a little more detail?
Yeah, well, sure.
Yeah.
I'm Pat McGinnis. I'm the founder and executive director of California Advocates for Nursing Home Reform. I started this group in San Francisco. Actually, the Gray Panthers in Berkeley helped me start too. And I worked very closely with the Gray Panthers in San Francisco at the time, back in 1983. So that gives you an idea how long we've been around. We expanded to California in all of California, not just the Bay Area, in 1990. And we have an 800 number, so we serve folks all over California. We've had a number of calls from people who are very concerned about Laguna Honda, about transfers, discharges, things like that. We deal a lot with residents' rights issues, particularly. And of course, during the pandemic, the visitation issue was a major one. The fact that people were completely isolated and pretty much at the mercy of the facility since nobody could go in. Anyway, this is Laguna Honda, of course, is very dear to our hearts. I mean, this has been a wonderful facility for so many years, and we visit there often. But today was interesting. They had a call this morning with, excuse me, CMS, the Center for Medicare and Medicaid Services, with the Department of Public Health, and the San Francisco Public Guardian was on there as well. They noted that all the discharges are voluntary. It will be voluntary, which is absolutely not true. We've already had represented 2 residents there who were involuntarily discharged. One resident, we won the hearing. Our advocate won the hearing for that resident. He went up to reclaim his room, and they called the police, had him arrested, and put him in jail. She went through it again. And again, the same thing happened. Finally, our advocate went with him, and they had a care conference, and now he's been able to stay at Laguna Honda. The shelter placements, they say, are only approved once the physician and the treatment team feel it is appropriate and recommended. And our question was, of course, how is a homeless shelter ever recommended as an appropriate placement for somebody who only the day before needed skilled nursing care, which is very interesting to us. They say that that they have appeal rights, and at least they've affirmed that, because we were having the Department of Public Health saying that they actually did not have appeal rights, that if you were given a notice of transfer or discharge, you have the right to appeal. That's under federal law, that's under California law. And the Department of Public Health was saying, no, you don't. And Laguna Honda was saying, basically in their written materials, that if you do appeal, your care might not be covered. I think it was Carol from Legal Assistance for the Elderly who noted that to the call this morning and said to the Laguna Honda needs to get that off their website, because that was absolutely inaccurate and illegal. But it was affirmed that people do have the right to an appeal. Only what they're saying is only in limited circumstances. It can't be related to the closure, that it can only be when it's an inappropriate placement, or they no longer need, if the facility is saying they no longer need that level of care. One of our advocates asked for the citation to that, because that's certainly not in any law that I have read, and I know the laws pretty well. And of course, they haven't sent that yet. Nevertheless, people do have the right to appeal. They have the right to a 30-day notice. They do have the right to have their care paid for while they win that, if they win that appeal, and while the appeal is pending. As Teresa noted, that the public guardian said that 2 of the residents that they represent died within days after their transfer. And transfer trauma is a major, major issue, particularly when the Laguna Honda is talking about transferring people out of the state down into Southern California to Orange County. We're all over the place. And one of the people up there who are trolling for the residents is Brias Rockport. In fact, that was mentioned on their slideshow this morning. One of the worst performing nursing home chains in California. probably have together more citations and more deficiencies than any other nursing home chain in California. And yet they're working, the Department of Public Health, our Department of Public Health in California, and Laguna Honda and the city of San Francisco is working very closely with Brias and Rockport to try to get people placed in their facilities. Frankly, people would be better off even with the citations that Laguna Honda has. Even if they're not corrected, they'd be better off there than in some of those facilities. The other thing is that they said that there's no quota, and there isn't a quota. People have been saying that they have to get rid of 120 beds or 120 residents. There is no quota, but how the federal law is that if you are certified on or after November 2016, or you have to get recertified, which is the case of Laguna Honda, then you have to have only 2 residents per room. And that's one of the reasons why they're trying to lower the occupancy rate there. But there isn't a quota per se, so they say. They said this morning, and their count seems to be off. They said that 48 residents were transferred already, and that they were all voluntarily transferred, which I find very hard to believe. Of course, if you're told you better take this facility or you're not going to get a place and we're going to end up sending you to Oregon or to, out of state, then that's the kind of pressure that the residents are under. One of the things I want to mention is that we've been working with a coalition. We're working with Legal Assistance to the Elderly, with Bay Area Legal Aid, with Sid Wilinski, with a number of other groups and organizations, and with disability rights, to see what we can do legally to stop this. One of the things that we did do is we had a meeting with CMS, with some of the representatives from CMS about a week ago. We were saying that Secretary Becerra needs to intervene, and he needs to do that immediately. We were told that, he doesn't really have that discretion. In fact, we keep hearing that they're really going out of their way for Laguna Honda because in most facilities, they only get 30 days, which is not true at all. In fact, under the...
Are you here?
Okay.
I'm sorry.
If you're, you should be unmuting yourself if you're not speaking right now. Otherwise, we will mute you.
That was a warning. One of the things that we made very clear to CMS is that the federal regulation gives the secretary great discretion. So we're asking the Secretary Becerra and CMS to extend the funding beyond September. There is no reason why they can't do that, to extend the Medicare, Medicaid dollars way beyond September. We're asking them to honor the appeal rights of the residents and to not be limited because they don't have there's no federal law or state law that echoes what they were telling us this morning. And we're asking them to rescind the order to close. Now, the secretary has the discretion to do that. There is no reason whatsoever to put people through the kind of pressure that they're going through right now, particularly people who will qualify for long-term care. So we're looking for, and we want to put pressure on Secretary Becerra. We want our elected representatives to do that. We want the mayor of San Francisco to tell Secretary Becerra, hey, stop this. Stop this now. There is absolutely no reason for this when he has that kind of discretion to put people through such pain. Anyway, I'll stop. I just wanted to say that the regulations give the secretary discretion in setting a date for closure and requires closure notices to provide assurances that the residents would be transferred to most appropriate facility or other setting in terms of quality, services, and location, taking into consideration the needs, choice, and best interests of each resident. That's federal law. That's not being followed. Not by Department of Public Health in California, not by Laguna Honda. And I'll finish on that. I'm sorry. I know I sound very hoarse.
Okay, a point of clarification, Pat. When they said there's no quota, it means they don't have to discharge a certain amount of people per week or per day or per month.
Right.
There is no quota.
No, that's what they meant. But, what they're doing is another.
Right.
what they say and what they do are two different things. But no,
Right.
and actually there wouldn't be a quota because they're certainly down a number of beds from when they started out. I don't know if they probably have to relocate people. If you're in a 3-bedroom, you might have to relocate to a 2-bedroom, but they've got the room up there.
Yeah. Okay, Derek, are you ready?
Guy's good.
Yeah, I'm ready. I just
Remember,
wanted,
excuse me, Derek, if you're not a speaker and designated to speak, if you haven't raised your hand, please mute yourself. Thank you. Go ahead, Derek.
oh, okay.
This
Am I being heard?
Yes.
Okay. So I just wanted to shed a little light on why this is happening, why CMS is cracking down so hard. The first part has to do with uncontrolled use of illicit drugs in the hospital. And this persisted over several surveys, leading to an immediate jeopardy declaration. And that was over a 6-month period of time. They still had illicit drugs. So that's one factor. The second factor is COVID. The reason that the 3-bedrooms are being required to transfer to 2-bedrooms is really related to the spread of COVID. Even the Biden White House issued a bulletin just a month ago calling for the abolition of 3-bedrooms in nursing homes and referencing the mortality that occurred as a result of COVID-19. So you've got the White House speaking against 3-bedrooms, and CMS is under the White House, obviously. So I think that this issue took on greater importance, particularly because during the last survey in April, Laguna Honda was deficient in managing infection prevention measures. There were all kinds of problems, including on wards where COVID had an exposure. So even on those wards, the staff were not using the masks properly, the guards, the gloves, disposing of waste, etc. So we've got two reasons: illicit drugs and COVID. So it's now CMS can issue a waiver on this reduction of beds from 3-bed to 2-bedrooms. They can hold off, but in order to get the waiver, the facility has to state in writing that it's extremely burdensome and keeping 3-bedrooms would not affect the health of the residents or the staff. And apparently, Laguna Honda has not sought a waiver and has not been able to claim that the 3-bedrooms do not pose an increased risk of spreading infectious diseases. So this issue of 120 beds, now because 3-bedrooms are being collapsed into 2-bedrooms, 120 beds are off the table. And the licensed bed at Laguna Honda have fallen to 649. So they've lost the beds. But it's going to be hard to contest this because that particular reduction is linked to COVID-19. Now, the other thing I wanted to mention is Laguna Honda was notified on June 30th that they would have to cut the 3-bedrooms into 2-bedrooms. But Laguna Honda knew about this 3 weeks before. We obtained the emails from CMS and CDPH where they were telling Laguna Honda that there's going to be no waiver and there's no flexibility. That rule is firm. But it took Laguna Honda 3 weeks before they made it public. So one of the problems we're facing with Laguna Honda is that there's important issues that are occurring, but are not percolating to the surface for several weeks. That makes it difficult to plan interventions when we don't exactly know what's going on. So I think I'll stop there.
Lakeitha, can you speak? You're muted, hon.
Sorry.
There
Hi,
you go.
everyone. Yes, I am ready. Okay. Hi. Good evening. My name is Lakeitha Pierce. I am a human rights organizer at the Coalition on Homelessness. I was born and raised right here in San Francisco. I have many connections to Laguna Honda over the years. My grandmother had a knee replacement in the 90s. My first job I actually had ever was working at the Laguna Honda Plant Services. And once I was 18 to about 32, I was a nursing assistant, and I worked through registries being assigned at Laguna Honda, working directly with the patients with their daily care and everything like that. So Laguna Honda means a lot to me also. And over the years, it had a lot of impact of my life, throughout my life. So I could only imagine, what it means to the patients and the patient's family and things that receive the care there, as of now. For those that have
in the car, I got the.
For those who have to relocate, it's important that the move is comfortable and their destination has all the services that they need, that they definitely need. I recently also worked at a shelter-in-place hotels and also the Navigation Center here in San Francisco. The Navigation Center is a single adult bed shelter for a single adult bed shelter where I'm sorry. This is my first time speaking publicly, but it's a single adult bed shelter, and the shelter in place hotels is where they have hotels and they house people experiencing homelessness that are most vulnerable throughout the pandemic. The people that are most vulnerable to catching COVID and other diseases. While those places are very helpful to some, there is no medical staff available for guests that are in need of it, and especially those that have dual diagnosis, like mental illness and medical illness, or mental and substance abuse issues. They don't have people that have training to deal with that, with the compassion and emotional connections that you need to help a person in that situation. A lot of staff are not trained in those spaces. Also, a lot of people, they tend to end up in single room occupancies that are also called SROs. It's basically like you get your own room. It's usually a shared bathroom or a kitchen. They have counseling services at some sites and other activities, but there is no medical assistance there. And depending on where you are, you can have your in-home care provider or home nurse come and visit you, but that's just about it. Also, they are placed in medical rescue centers, but they do have medical attention, but the beds are limited and the priority is given to those usually just coming out of the hospital. And the congregate shelters are like a large area with multiple beds. They do feed you and they do have counseling service, but there is no medical assistance. Let's see, I'm sorry, I lost my place. Oh, where am I? Okay. So many of the unhoused elderly people who are far too impaired and frail to live independently in a single room hotel, they are just being left behind closed doors. As a non-medical staff, when I was a non-medical staff, I remember being handed a huge pack of pills that was sorted by the day that was to be given to a resident who was like, he was constantly falling and having head injuries and stuff. And he was just too impaired to understand or remember to take the pills. And I had no medical training about the pills or what could go wrong. People end up in the hospital because of their health problems becoming too severe to stay out. For so many of those people that are unhoused or marginally housed, there simply is not an accessible system of services to prevent deterioration. They're usually transferred to General Hospital, then Laguna Hospital because they can't stay safely and live independently, and the beds are cheaper at Laguna Honda. Then after that, they're discharged to a shelter or a medical respite from Laguna Honda. When they're transferred out of a medical respite or shelter, the cycle starts all over again, and they're back in General and back in Laguna Honda. So really, like, I think the big answer to this problem is, of course, housing for all, and also people that can pay more attention to the actual needs of people. Like, people have, specific needs. Everybody can't be, taught by the same book. Everybody can't go by the same rules because everybody is different. They need different services and they need different, ways to deal with them. And that's what this city seems to lack a lot of compassion and a lot of getting to know the people that really do need the services, so you can point them in the correct direction and not just throw them in hotel rooms or even put them in a home that they won't even be able to take care of on their own. Thank you. That's all.
Well, Lakeitha, I wonder if putting people in Laguna Honda was a way of avoiding creating specialized programs for disabled people with dual diagnosis.
I definitely can agree with that. Definitely.
Yeah, and I don't see the health department talking about creating special programs to accommodate. There's a lot of general talk, but specifically about people that ended up at Laguna Honda.
Mm-hmm. Yes, and there is a lot of so many of the nursing homes being shut down and everything. It's just like not nowhere for people to go. And that's how they end up wandering the streets and back inside the hospitals again. It's like, a lot of times they go to the hospitals to get somewhere to lay down or get somewhere to actually rest. And it's just becoming a horrible cycle. And I feel so bad about, what is going on at Laguna Honda, because I remember how it was at once, but because it seems like because the system is broken in so many places, it's just broken in so many places. So the people that can't really speak up for themselves and can't really do for themselves, they don't get the attention that they need at all, and they get pushed off at the cheapest beds that are available, pretty much.
Thanks.
Can I ask you a question, Lakeitha?
Uh-huh.
According to Laguna Honda, they said that they send people with the residents to make sure that they can shadow them, make sure that they're okay, to avoid transfer trauma, blah, blah, blah. Have you seen any of that?
No, I've never seen any of that. Like, I've literally never seen any of that. I've never seen that, like, at the shelter-in-place hotels. Like, I've worked in the navigation centers and I've also worked in the shelter-in-place hotels. Those are two very different places. Right. At the hotel, like, I would think that they would have more help at the navigation center, where it's a congregate area and it's people that's able to look at them. They're not medically, certified to do it, but they can actually see them. But at the hotels, they're just left in rooms to themselves, and they, in hopes that the home bridge or maybe in-home care service will come and stop by. And most of the time they will come stop by, knock on the door, say, hey, do you need help? If they say no, they'll just walk away and won't even press the case. And like, I've had clients that just laid in their own mess because they don't have, like, they're not able to care for themselves. And then other staff, they get mad because they're like, oh, what's wrong with you? And but not even understanding or having the training to even deal with anything like that. And it's really sad.
Thank you. That's what I thought. I can't believe that they're sending a staff person with the resident to the homeless shelter and
I've
saying, we want to make
never
sure you're all right over here.
I've never seen it. At the most, what I do notice for honestly, I noticed that the company that I work for, they will come up with their own people, because I've seen like in the beginning where maybe they'll send an outside person that like maybe there was a person in the beginning, because I've been there since 2020. So maybe in the beginning there might have been a person that'll come in with some of the guests and they'll, help them get settled or whatever, get stable. But a lot of the times the home-based shelter, they will tend to push outsiders out. If you understand what I'm saying, they'll push outsiders out, and then they'll come up with their own program within the shelter to, kind of make up for that. So they'll have somebody meet them at the door and like, okay, yeah, I'm here to help you with this, that, and the other, because they don't want outside people coming in and saying, hey, these people are doing this, that, or the other, or, they're not doing this, that, or the other. So, and they feel like they're going to be losing out on some money. So they want to, try to they seem to think that they have all the answers, but they don't even have all the training. Like they barely have the training with dealing with people in the shelter, like definitely not the medical training. So it's like, instead of having an actual medical team or people that, actually know and work with these people, instead of having them come in and, kind of get in their business and see what's going on with them, they rather, come up with their own bootleg version of what what could really support the people.
Yeah. Are there any other points of clarification between the speakers before we open it to Q&A? Derek and Pat and Lakitha?
No.
I just wanted to say one of the things that they talked about today, they said that there are 3 major barriers into finding placement. What did they say? They called 1,400 or something placement places to try to find placement for people. The barriers in moving residents to skilled nursing facilities. This is that right. Level where there were too few staff in those facilities. And of course, again, that brings up the question of why. Why does the Department of Public Health Licensing and Certification allow that to happen when the overwhelming majority of these facilities are for-profit corporate chains? And they got millions, if not billions of dollars during the COVID period. They didn't pass it through to the staff. Secondly, they said because of COVID, because there are more COVID outbreaks now, albeit maybe a little bit milder, but there are more COVID outbreaks, so they don't want to take more people. Although that didn't stop them over the last 2 years. They took anybody they could, as long as they could get Medicare dollars for them. Mm-hmm. And then the third one was that there were no beds available. I can tell you right now, one of the things they did not mention was Medi-Cal discrimination. Yeah. We've got an epidemic of Medi-Cal discrimination in California, probably across the country, but in California, you try to find a facility, a bed with Medi-Cal, forget about it. If you just came out of an acute care hospital under the Medicare program, you'll find a bed real quick because they get at least 2 or 3 times as much as the Medi-Cal program pays. Or if you're private pay, you'll find a bed real quick. Mm-hmm. But they didn't bring any of those issues up, and they don't look into those issues because, of course, that would be too much. The Department of Public Health might have to actually do something for their money. But anyway, I'll stop.
Pat, did you want to mention the town hall tomorrow?
Oh, yeah, we're having a town hall at 2:00 tomorrow. You can find the flyer on our website if you want to register. It's going to be about residents' rights. What are your rights as a resident? It's for the family and friends of residents in Laguna Honda and for the residents themselves. In terms of transfer discharge notices, what the notices have to say, that you do have the right to file an appeal. And they made it clear today that, an inappropriate placement, we know that there's going to be tons of inappropriate placements because one of the things in the regulation is that if you have family and friends in San Francisco, you don't transfer somebody down to Los Angeles or up to Oregon. That would be called an inappropriate placement. or trying to say that you no longer need that level of care. One of our advocates just had a hearing or a care plan meeting about that very issue. They were trying to say this person who has multiple ADLs, multiple needs. And it was interesting. I saw Jessica's remark about home and community-based services. There are numerous home and community-based services. That's not something that Laguna Honda tries. I mean, it's easy to say to somebody, well, why don't you take your dad home or your mom home? If you live in a one-bedroom apartment and you've got a family and you work full-time, that is an impossible situation, and they know it. But in terms of getting into the community transitions programs, trying to find local, assisted living, those kinds of things, I think it's just beyond their capacity to try to work with the community transitions programs and some of these home and community-based services. But our advocate explained that. And so one of the clients that we're working with is going to be going to a community transitions program.
And we would like anyone that knows a family that has residents at Laguna Honda need to know about this seminar that CNHR is giving tomorrow, so they know their rights. Because they can appeal, but they're being discouraged from doing that.
I'll put our website, I'll type that in here.
Gary, we have one person with their hand raised. Do you want to open it up for questions?
Yeah, let's, is that okay with everyone? Let's open it up to Q&A. Yeah, can you do the hands, Art?
Sure. Joseph Urban will be recognized. I just want to say, if you do have a question, raise your hand or put it in the chat. Go ahead, Joseph.
Question to clarification from Dr. Derek Kerr. You had mentioned that there's the 3 to 2 bedroom reduction is due to, or that seems to be the metric of reducing from 3 beds to 2. In Laguna Honda, there are bedrooms that are in 3 orientations with 1 bathroom. We heard that maybe the metric was more about the beds per bathroom versus beds per room. Could you clarify if we're incorrect in that assessment?
I don't know. What I've been able to find is that it seems to be tied into infection prevention and COVID.
No, it's a regulation that was enacted in November 18th, 2016. You have to have 2 beds to 1 bathroom. And that's exactly what it is. And then if you were certified before that, that's fine. But if you have to get certified after November 18th, 2016, or you are going to be recertified after that date, then you have to have 2 beds to 1 bathroom.
And I believe that the 3 bedrooms at Laguna Honda have 1 bathroom.
Probably. I mean, they used to have the whole big units. Remember those? Remember the big wards that they had when they had 12, 13 people to a ward? And frankly, a lot of the people liked it. I mean, if you want privacy, you didn't like it, but if you were young and you had a group that you hung out with, they liked it. But this was, Joseph, you're absolutely right. It had to do with the bathrooms, no more than 2 beds to 1 bathroom.
And the regulation also says that each patient must have 80 square feet of living space. And I don't know whether those 3-bed suites allow for 80 square feet per patient.
Yeah, I don't know.
Pretty close, yeah. I think they do.
Okay, our next question from Lygia Montano.
I was wondering if Conner or investment have spoken with people that wanted to be discharged, that can and wants to be discharged, and those that were forced to be discharged. Have you been in contact with them?
You want to know if we've been in contact with people who want to be discharged? You mean to home or to someplace else or what?
Yeah, no, I wanted to know if you have been in contact with the ones that were forced to get discharged.
Yeah, we've had 3 different residents who called us that we've represented so far.
But have you have access to the rest of the people in there? So do they know that they have the right to appeal this
Well, that's why
charge?
we're putting on that town hall. We put out flyers and we gave them to people to pass around at various times. So, I mean, we do have contacts at Laguna Honda and we've passed out our flyers. But that's one of the reasons why we're having a town hall. We want people to know what are your rights. And we have, on our website, you could download one of our Know Your Rights flyers at Laguna Honda.
Okay,
Yeah,
we
but
have,
not everybody has access to internet.
I understand that. We actually produced quite a few of them and gave them to the San Francisco Ombudsman Program as well, who does have access to all the rooms. And we're hoping that tomorrow, after our town hall tomorrow, that we'll get a lot of these flyers out. I realize that they have to be physically sent around.
we have a question in the chat from San Francisco Examiner reporter. Sydney Johnson asks, she says, thanks for holding this. Just wanted to clarify a point that came up earlier. Have any residents been discharged to SIP hotels already?
Not as far as we know. They said that there were only 3 that were discharged to homeless shelters. And as far as I know, I don't know that anybody's been discharged to one of the hotel yet.
Actually, I think Lakeitha was talking about shelter-in-place hotels as an example of a long-term SRO. The shelter-in-place hotels are being slowly closed, and all of the residents that can't be relocated to permanent housing are being moved into, what's that big SRO they're being moved into?
The navigation centers, or
one of the big SROs. They're consolidating the shelter-in-place people.
yeah, like the
Whitcomb.
The Whitcomb, that's the shelter-in-place hotel.
Yeah.
And the Whitcomb is a shelter-in-place hotel, but like the next door shelter, that's an actual that's a navigation center or a congregate hotel. I mean, a congregate shelter.
Karen Fishkin has her hand up, and I want to let you all know that Supervisor Meligar has arrived, and maybe somebody could give her a little update after Karen asks her question. I don't know.
Okay, yeah, I wanted to know if, when all is said and done, do the people who have had to leave Laguna Honda, do they have any priority or any ability to come back if that's what they want?
Probably not. And this is the reason why. At least according to Laguna Honda, they're saying that all of those were voluntary discharges, which I don't believe at all. I absolutely don't believe. I mean, what happens is that you are, do you want to be hung or do you want to be shot? Which is kind of how it's presented to them. And if you wait until the very last minute, they repeated that again today. What happens after September 13th? If there's still people there, what happens after that? You're going to close it down. You're going to force. Well, we don't want everybody to be. Then they won't have any choice, and then they won't. This is ridiculous. What they're doing is that they're just scaring the hell out of people, and so.
Well, they also told us what sounded to me like a fable about that if the people stayed after decertification or after September 14th, they would be pulled off Medi-Cal and would have a hard time getting it again. And that strikes me as
well, that's false. Number one, it's
false.
Absolutely false. It won't.
That's very threatening.
Pardon me.
That's very threatening.
Well, it's not true. I mean, it's
a lie.
The facility will not get reimbursed the facility won't get reimbursed for Medi-Cal or Medicare if they're decertified. There's no question about that. But nevertheless, the city of San Francisco that puts millions and millions of dollars up for Laguna Honda every year, and I believe our tax money goes to that as well, because didn't we pass a bond issue several times for that? That the issue is we want Becerra to extend. We don't want it to be, we want to extend the funding. We want to have everybody be able to get either a safe placement or to be able to stay. And that would be easy to do. You can extend that period, the funding, through the end of December. And by that time, if Laguna Honda is not certified by then and they can't pass their recertification, maybe it's going to close. But, it gives that extra time. And there is no reason, frankly, in my mind, and we're dealing with nursing homes for almost 40 years. There is absolutely no reason for Laguna Honda to be decertified when I look at some of these other facilities in this state that have the most atrocious care. They killed 10,000 people of COVID last year. And I'm looking at Laguna Honda. How many died with COVID last year in Laguna Honda?
6 all told.
Yeah, I've with 700 and something residents. They had model protocols for dealing with COVID at the time. I was sending those to other counties, in fact. So when I look at what's going on here, we say it's not political, but come on. There's no reason for Becerra not to have the pressure put on by the kind of powerful politicians we've got in this city and county. Anyway, I'll stop. I'm going to start yelling.
There's a question.
So how can we put pressure on the right people to get the right thing to happen, which is Laguna Honda to stay open and the human rights of the people who are already there to be honored? How can we do that?
Well, we put pressure on Becerra to extend the funding, regardless of what's going on, extend the funding beyond to December, the end of December. Give Laguna Honda a chance to come back into compliance. Give the residents there an opportunity to be able to not live in fear of being transferred to someplace way far away from their families and friends. And the only people who can do that are people like Nancy Pelosi, our board of supervisors, our mayor. They should be standing up and putting pressure on him and saying, what the hell are you doing here? This is ludicrous. When you look at and then you're putting people into Brias and Rockport facilities. There was a facility in Fresno. They had $950,000 in federal fines. They were decertified. The attorney writes a letter to CMS, and then they got their certification. Nobody had to be transferred, and they didn't have to be closed. And I could give you 50 other examples just like that. So that's why I look at this, and it's so perplexing to me of why this is happening.
How can we as a group help to put pressure in the right places?
Well, we have a supervisor here. We could ask our supervisor.
You get.
Hi, everyone. I'm sorry I'm late. We had a board meeting today and I got a flat tire on the way home. So I'm sorry that I was not here with you at 6 o'clock. But I can talk about some of the things that have been brought up by Pat.
Myrna, you want to introduce yourself? Introduce yourself a little.
Teresa. Of course, thank you. So I'm Myrna Melgar. I'm the supervisor for District 7, which is where Laguna Honda is located. So I can tell you that Javier Becerra has been, the pressure on Javier Becerra has been a constant since we were decertified. So we already have been decertified. The Nancy Pelosi, Javier, Senator Padilla, Senator Feinstein, our governor, all of these folks have been putting the pressure on Javier Becerra, including Kamala Harris. I mean, San Francisco has a pretty good, representation in the leadership. So that has happened. I did reach out through my connections of the Latino community in California that supported Becerra when he ran for Attorney General. And none of these pressure points have really yielded any results. He has just kind of this is not something that I'm stepping into so far. But so my ask of him has been very specific. So there's two things going on at the same time. There's the recertification process, and then there's the closure plan. The closure plan is something that we entered into in exchange for Javier Becerra to extend the funding, which really was supposed to be only 30 days, but has been extended until September. And so that is what's going on. He does have the power to extend it to December, as Pat said. He also has the power to step in the closure plan, which we actually signed into, and say, hey, these people's lives are at risk. Let's try to come up with something else. But that has not yet happened. But that has been the specific request that I have made and other advocates have made. It's about the closure plan. And so you may have noticed that I called for a hearing today, which will be heard at the Government Accountability and Oversight Committee of the Board of Supervisors on the 21st of July. And what I would like to get from the Public Health Department is, what is our bottom line? So if they are reducing the census, who is being targeted for this reduction? Who are we going to say, who are we going to fight for? We know that there is a certain percentage of folks who are at risk of death if we move them. And our public health director has the authority to step in and declare this. So there's precedent for this, because I don't know if you remember in Oakland about 15 years ago in Oakland, Chinatown, there was a building that was slated for redevelopment, the Park 55 Hotel, that was full of elderly Chinese seniors. And the public health director in Alameda County stepped in and said, no, if you move these elderly seniors, there is all this scientific evidence that their health outcomes will get worse and some of them may die. So because he issued that health order, the developer was prevented from going further, and they negotiated that they would stay put while the redevelopment of the building happened. So I think that we can do something like that, but to begin with, we need to just identify and then commit that if the CMS comes back and says, well, because you're not following the closure plan, we're not going to give you the money anymore for reimbursing for these patients, we as the city of San Francisco can carry those costs until such a time as either we are recertified or we can find placements for everyone. And so, we do have funding in our reserves to cover in the event that Medicaid stops paying for these folks, but we have not yet even posed ourselves the question. So that's what I'm hoping to do at this hearing on the 21st.
We have some questions in the chat, and we have one person with his hand raised. I'll do one from the chat, and then Joe Urban. The question in the chat is from William Jenkins from Mission Local, a reporter. In 1999, voters were told Laguna Honda Hospital would be 1,200 bed facility for the elderly, but instead received a 700 bed facility.
Good, how are you? Have a good night.
Which over time has served for people with SUD. I don't know what that is. Any thoughts on this? What does this mean? William, you want to clarify anything in that question that's not clear?
William, I'm not here to answer questions from the press. I'm here to answer questions, with the community.
Actually, the question is going to other speakers too, Myrna.
Okay.
Yeah,
So,
I can answer that. It used to be licensed for like 1,100 and something beds. It really was back in 1999. And then there was a lawsuit filed against Laguna Honda. They got waivers back then to have open wards. And so they would have, like 12 beds to a ward, that kind of thing. They got waivers from HIPAA, the Healthcare Financing Administration, which CMS is now. And so there was a lawsuit that many of the people who were in Laguna Honda would be better off in the community. And so they repositioned Laguna Honda and they reduced it to 700 and I think it's 65 beds now. And it was always a skilled nursing facility. I think that, Teresa and Dr. Kerr talked about that in the beginning. The problem is that it was supposed to be for skilled nursing care. It's not supposed to be a mental health facility. It's not supposed to be a drug rehab facility. And unfortunately, Now they have all 3 tiers in there. And that's what happened over these past, 5 years, 10 years? Dr. Curry, you'd know better than me.
Yeah, let me piggyback on what you've said. There was the Supreme Court decision, the Olmstead decision in 1999, just when,
Right.
Laguna Honda was.
That's right.
funded.
And that's how they sued. Right. Exactly.
And so that moved away from institutionalization. And then the controller at the time, Ed Harrington, wrote a report. And it addressed the Olmstead decision. And it also addressed the huge cost overruns at Laguna Honda. The cost had doubled from 300 to 600 million. So they had to stop the construction. And by reducing to 780, they saved millions of dollars and were also, sort of conforming with the Supreme Court decision. And what they said they would do is set up a fund for, community supported housing.
Right.
Now, the controller this time around, Ben Rosenfield, looked at the cost of paying. If CMS stops the payments in September, the city would be on the hook for something like $16 million a month.
Well, that I want to just clarify. We're not asking Becerra to deal with it. If this is not about certification or recertification, we're simply saying extend the funding period through December.
Yeah.
And he does have the discretion to do that. There's no question about that. It's in the federal regulations. It's in the law. So we're not saying don't decertify or, stop this now. But I can tell you that the closure plan and the transfer plan that Laguna Honda has submitted doesn't comply with what they're doing. And that's why I say Becerra he's the one. He's the only person in this. HCFA doesn't have or CMS doesn't have the authority to extend the funding without the secretary's approval. That's
right.
one
And
of
the secretary already did it once. I just want to point that out, Pat. That he's
I know
already
that, and they keep saying, "Oh, it's so unusual." It's
can
not
do it
that
again.
unusual. It's just not. That's that BS excuse I keep hearing. Oh, it's so unusual. Look, he did you a favor. He's not doing anybody any favors with this mess that's going on right now. He has the discretion to do it, and if you've got the discretion, why not use it if you can save people's lives? 2 people already died within days after their transfer. Anyway, I'll stop.
Joseph, you want to ask your question now?
Yeah, thank you. So we're under the gun here with our family member. She's going to be moved to a BRIAS facility in Burlingame on Friday. So time is of the essence in terms of our decision to move forward. We've done our research. People are very nice there, but the data behind that facility is non-existent, and we're being told that there's an umbrella certification. That they're under the San Mateo skilled nursing certification, and they're kind of riding on their 4 stars, even though a number of people died from that facility during the COVID pandemic. So we're very concerned about that. I don't know if there's anybody has any information about the legitimacy of that organization, specifically Burlingame. We understand BRIAS, we understand the background behind BRIAS. But that facility in particular, which has a number of open rooms and a lot of people from Laguna Honda are going to get funneled there very quickly.
Yeah.
They're not connected to any CMS record or rating. There's nothing.
That's because they're probably not licensed. One of the problems with the Department of Public Health has given BRIAS and Rockport the ability to operate numerous facilities without a license. Give us a call tomorrow at the 800 number. And Mike Connors can fill you in exactly what's going on with all of the BRIAS Rockport facilities.
Okay. All right. Well, all right. So we're going to tell Laguna Honda that we're not going to move forward.
Yeah, no, you have a right to, and also have you contacted the ombudsman? Has the ombudsman been helpful at all?
No. Nice guy.
Nice to chat with, but
he's not taking any action. So you know what?
Yeah, this is the ombudsman's job. This is pretty tragic that they aren't helping more.
Yeah, there's a lot of complaints, not a lot of action. So we actually took action. I'm the guy that started the petition to put some pressure on
right.
Sarah. So we've got, as of now, 303 signatures. I didn't want to put the link on the chat unless you guys are okay with me doing that. But that's my intent, is to put direct pressure. I'm talking to all sorts of folks at City Hall as well. So that's the direction I'm trying to take, and also writing articles as well. So, public pressure apparently is the one thing that's not happening. It's all through the politicians. So my understanding is that the more public pressure it comes, that's the one more straw on the camel's back will push Becerra over the edge here.
Yes.
What we can do.
Yes.
Joseph,
absolutely.
is there any way that we could translate that petition to Spanish?
Oh, it's on change.org. Teresa, you and Art, again,
I will do it. I'll do it. I will translate it to Spanish. I just think that he will respond to that differently. So let's do as much as we can.
Okay.
Yeah, one of the real problems with that petition is it said that the problems are minimal at Laguna Honda,
Well,
and CMS knows they weren't.
I guess minimal, really.
And that's one of the problems with the wording of that petition.
okay. Well,
I think we still need to put pressure on Becerra, and I don't want to mess up any efforts to do that.
Mhm.
But CMS knows darn well that the problems weren't minimal at Laguna Honda.
So
Yeah,
the way,
but there's nothing that can't be corrected, and we know that too.
Yeah.
I mean, that's the other thing.
Yeah,
Compared
okay.
to some of the other facilities. But Joseph, do give a call, and we can tell you about all the facilities and who actually owns them and who's running them.
okay. May I add one more insight about the transfer? What I see here is actually 3 layers. One layer is that everybody has to be out by mid-September, which I'm pretty sure can't be accomplished. And there's an agreement to do that. This is the second layer, so that the funding continues through September. And the third is the recertification. And we got them all kind of bundled together in one big bucket. And so I've been thinking that at least separate the recertification out. But I'm also wondering, are we jeopardizing recertification by allowing people to stay there? And is that the reason why Laguna Honda is saying, you got to get out because we got to get recertified, and that's more important than the few months we've got being vacant? So that's where I'm kind of looking at that cross-eyed, wondering, is it more like a positioning they're trying to do? They just need to get this recertification too. And I personally am a healthcare consultant. I've worked with CMS. I've done audits with them with CMS. So I know they're people, and they're tough. So they're going to play hardball. So is that part of the strategy, where you don't want to piss off the guy who's going to sign the contract to let the certification through?
Yeah.
So let's get everybody out and not jeopardize that certification. That's what I'm thinking has happened. So unless I hear it otherwise, maybe Myrna, maybe Pat, you've heard back from them that now they have some wiggle room here. So that is what,
yeah, Joseph, that is what the Department of Public Health has been doing. That's exactly that was the calculation. So they are legally 2 separate processes. All the lawyers have told us they're 2 separate, unrelated processes, but because we signed on to the closure plan, and the closure plan says that we will make our best effort. That's what it says. It doesn't say that we need to move out everybody by September 15th. It says make our best effort, but they keep pressuring us, right? Because as you said, they're, hard asses. And so we are sort of under the assumption this is a bottom line for CMS, and we don't want to piss them off, because they're also going to be the people who are deciding on our recertification. But I think, what I'm trying to get to at this hearing is like, what is the bottom line for us, independent of CMS? What are the people of the city and county of San Francisco willing to pay for and do to keep people in place? Even in the absence of the funding coming in, so that we don't risk people's lives until the recertification process is over, because we have been told that legally they're 2 separate and distinct processes.
Okay.
Yeah, they are.
Michael Lyon has a question in the chat. Do you want to speak it, or want me to read it, Michael?
You can read it.
Okay, Michael Lyon says, what's the likely effect of more aggressive approach to drug use on Laguna Honda and the situation of frail elders?
Could you clarify that question, Michael? I mean, you mean whose drug use on who?
Well, I would think with more aggressive with more police aggression against drug users like in the Tenderloin, stuff like that, that's going to make even more pressure on Laguna Honda.
I don't understand.
Oh, okay, drop it.
You know, the problem is Laguna Honda must only admit patients for whom it can provide adequate care. And if Laguna Honda is bringing in people who are actively using and overdosing, they are liable for that. The hospital is liable. So one solution is for Laguna Honda to restore its admission screening process where the doctors would assess the patients. And if the patients were too dangerous or too unstable to be safely managed, they would not be admitted. So that would be one solution. And I think that what CMS is doing now is forcing the Department of Public Health to preserve Laguna Honda for patients that it can handle. Maybe they need to develop an inpatient drug program. But they can't have people overdosing and distributing syringes and fentanyl on the premises. It's crazy.
Jessica Lehman has a question. She wants to hear more about the people who have died, the two people who were transferred and died as a result. I think she wasn't here for that discussion.
Yeah, that was the public guardian's office who was on that call this morning, and she said two of her, they have 120 clients?
Right.
Laguna Honda. Two of those clients where she agreed to the discharge, they died within days after they were transferred to a skilled nursing facility. I don't know. That's the one problem we'd like to know. We'd like to know which facility was that, but we don't know yet.
Okay, are there any more questions from those who want to ask them out loud? Otherwise, I'm scanning the chat for more questions.
Well, I was asking about, actively engaging in finding who are those people that are ready or safe to be discharged, and because this can be intimidating for them. And so if, and so maybe if there's a little more of just getting to know your rights information, a little more personal approach to the people, that and see that they can be relocated in a safe place. That's what I was asked.
Yeah. There's 63 people that don't need a sniff, and there's 600 that do, more or less. According to what they told us today, which doesn't quite add up, but it's something like that.
And those people have requested any type of support in getting relocated?
I don't know if they know how to. That's the problem.
Well, any transfer discharge notice has to be sent, a copy has to be sent to the long-term care ombudsman program. And anyone, that's the law in California, and I think it's also federal law. And they haven't been getting any notices of transfer discharge. I thought it was more than 48. They said it was only 48 voluntary discharges or transfers. But it's really hard to say.
Is there anyone from the ombudsman's office here that could answer questions? They certainly were invited, but it would be nice if, because what is the ombudsman's doing? That is the ombudsman's job, to defend the human rights of the residents on discharge. That's a major part of the ombudsman job. So what is going on with the ombudsman?
No, I think Benson's going to be at our, I don't know. I can't speak for the ombudsman program.
Yeah. To me, that's a major failing.
Well, yeah, I don't know.
Karen Ruda has a question. She has her hand raised, and somebody wants to. There's a question for Supervisor Melgar to tell us what she and the Board of Supervisors are doing regarding Laguna Honda, and maybe you could tell Supervisor Melgar tell us more about the hearing. But Karen Ruda, going to ask your question first.
Hi, thank you. My question is very simple: is what is the financial incentive for the city to close the facility? This is, I'm sorry, I'm new to this issue, but it just, something doesn't smell right here. So if anyone can weigh in, thank you.
Karen, there's no financial incentive for the city to close the facility. None. It is a big problem on our hands, and it's a crisis, in fact. So it is not our choice. It was the federal government. It's us, that has decertified us. So that's one. But the other thing about the question of what we are doing as a board of supervisors right now, as Joseph had articulated, we are being careful and collaborative with our labor partners and with the mayor so that we can be assured to put our best foot forward for the recertification, because we do not want to lose the hospital. We want to be able to have that be there for the next generation. So at the hearing, what we are concentrating on is the closure plan, not the recertification, because as I said, we want to collaborate and put our best foot forward for that. But what we want to do is make sure that we have a plan to protect the people who are most vulnerable so that they can stay put.
On the question that Karen raised, I just want to point out that Laguna Honda has never been able to really pay for itself. It's always been dependent on the general fund. 2 years ago, they got 90 million. Last year was 33 million. And this year's budget, the revised budget, calls for $130 million from the general fund. So theoretically, and in the past, when the beds were reduced from 1,200 to 780, money was an issue. So if money is an issue, it's a small amount, these millions of dollars that I mentioned.
We're we have about 15 minutes left on this meeting. I don't know if at some point maybe the speakers should summarize what they think we should do. And I think, Terry, you had some demands you thought maybe we should put together?
Well, I think the demands are that Laguna Honda has to stay open and the human rights of the existing residents need to be honored. And we need to tell somehow, if anyone can get word to people within Laguna Honda and families about the availability of CNHR to help, that would be good. I'm going to defer. I think this petition is one way of doing it, although I have some disagreements with the wording. It may still be one of the best things we can do. Can Pat and Derek and Myrna tell us anything else that we can do as individuals and as the San Francisco Gray Panthers to assist with these goals?
I'll send you our residents' rights fact sheet, and you can get it out to anybody you can. We also are working with a number of legal services organizations. It's not just Cantor, Legal Assistance to the Elderly, Bay Area Legal Aid. They all have, and the Disability Rights California can all advise people about their transfer discharge rights as well. And we also are looking at potential litigation, but we shall see. I can't really speak to that at this point.
Yeah, so the city's looking at litigation too.
Oh, good.
Our options are limited, and I know that Louise Rennie has been looking at litigation as well.
Yeah, I've talked to her.
The same conclusion in terms of options. what I was going to say is that nothing stops us from exerting public pressure, and there could be more than one petition. In fact, Teresa, if there's wording that you like better, let's put another petition together. Let's translate it to Spanish and Chinese. I think that all of the folks who are allies with the Gray Panthers, Senior Disability Action, CARA, like anyone who has a big network of folks who can be mobilized to send in petition to.
Joseph, did you want to say some more?
Well, first of all, I'd be happy to transfer all the knowledge of my petition to whomever wants to accelerate it. So I'm not proud. That's one thing. Also, I do want it to be known too that we did spend some time at Laguna Honda when I was promoting my petition while we were visiting my family member. I spoke to a lot of families there, and I was shocked at how few knew that this was even going down.
I know.
So something's not getting out to the family members. Maybe people that are the residents are getting the message, but I was just floored. I couldn't believe how many. There's actually a majority of the people that I spoke with that were there visiting did not know about it.
Well, they know that there's issues going on. One of the problems I have with the kind of correspondence that Laguna Honda sends to the families and the residents, it's very schizophrenic. We're not closing, don't worry. We're doing our, your care and your whatever is our first priority. But, and then they go on, but we have to do an assessment. We have to do, it's like, this is just for show, but we don't intend to close. They're not really serious.
I say some are living in hope and denial.
Well, yeah, if you think they're living in hope and denial, that's.
Yeah, exactly. Oh, no, I agree. I think that that's one of the problems. Educating the residents and the family members is very important. Yeah.
It just somehow there's got to be maybe the effect we could have is sit outside for a few days and just with the flyers or ask them to put a poster up. You can't walk through the front door without seeing what the heck's going on with a QR code and instructions in all languages. I mean, something's got to be more explicit than.
I think that's probably a good idea, is to actually stand in front and hand out flyers. Yeah. We'll talk about that tomorrow too.
Yeah, demo.
Well, there hasn't been one, and there needs to be one. This is one of the most important issues regarding long-term care this city has faced in a very, very long time. And I do think it's important. Excuse me.
Yeah. Derek, were you going to say something?
Yeah, I just, I want to support Pat's suggestion about asking CMS to extend payments until December. That's a politically neutral position. It respects the patients. It doesn't impinge on CMS's authority to crack down on delinquent facilities. I think that's probably the easiest and solution that can be accomplished fairly quickly.
So that could be the San Francisco Gray Panthers probably need to pen a letter. We need to work together to get all the elements we all agree on into that letter.
Yeah, I'm worried that if we challenge CMS and challenge the regulatory findings, that's just more fighting.
Yeah.
So, but asking for an extension, that'll give Laguna Honda time to get itself properly recertified. It'll take the pressure off discharges, so that would be a win-win all around, and nobody's nose gets bent out of shape.
Well, in our meeting with CMS, that's exactly what we asked for. We asked for A, to extend the funding, and B, we're not going to fight the certification of the recert. That it's decertified right now. We know that. Yeah. But they could extend the funding, and it's clear that the federal law gives him that kind of discretion. And also to honor the appeal rights of residents and not limit it like they were trying to do. And just protect the residents for as long as possible, because I don't think the Laguna Honda is going to close. I really don't. I don't think anybody does. And that's one of the problems. Is that, so what happens when there's only 300 people left, or you know what I mean?
But Pat, Laguna Honda and the Department of Public Health are acting as if it's going to close, and they're going to get their funding cut, and there's going to be a panic, and they'll have to send 600 patients out in one go. So I don't know where that comes from, whether that's an internal anxiety or whether they got that message from CMS.
I don't know.
Dr. Kerr, that was what you're talking about was discussed this morning at the San Francisco Department of Health hearing. They emphasized the need to get ready and not have to panic on September 15th because they still have residents.
Yeah.
Karen Fishkin, you have a question or comment?
Yeah, no, I have a question. Isn't there also a need to work out an agreement with DPH and San Francisco General Hospital so this flow thing stops?
Yeah.
I mean, that's where it all stemmed from.
Yeah.
And I haven't heard that mentioned.
Yeah, well, the DPH will never go for it because that's their holy grail and has been for 20 years. And no matter how much protest there was, they continued with it. So,
But it's led to this.
Yes.
And how is it not going to lead to it all over again unless something is changed?
Hasn't that been the source of the drug violations?
I think so. My guess is that this crackdown is going to force the Department of Public Health to reevaluate how it uses Laguna Honda and how it enforces this flow project. And it may be that CMS thought that was the only way also. I don't know.
Well, that was a good point, Karen.
Yeah.
That needs to be emphasized. Is Supervisor Melgar still on the Zoom? Do you want to comment?
I am. I'm so sorry. I was having dinner because I haven't eaten all day.
Sorry. Karen Fishkin raised the point that having a patient.
No, I heard her.
Okay.
So far, I do not know of any plans to tie the flow project to either, the recertification or to stop it or amend it in any way, but we can ask.
It seems to be a problem. Okay, David Williams, can you unmute yourself?
Yeah, I haven't heard anything in this whole discussion about staffing, the role of the people that provide the care at San Francisco, Laguna Honda, or about the threat of layoffs or downsizing or whatever might have to happen or be happening, or what role the union might be playing in any conversations or actions that are happening around this. So I'm wondering if anybody has some knowledge of that other than me. I am in that union and I have little or no knowledge of it. I get a whole lot more from you than from anybody else. But if anybody knows something I don't know, I'd love to have it so I can pass it on.
Well,
So I can tell you what I know. I'm sorry. So SEIU 1021 has been very active in all of the negotiations and also, sort of trying to get to the bottom of the. I'm so sorry, my little dog is.
Okay.
Uh-oh.
I'm sorry. So as I was saying, the union has been very active in these issues, but they're, understandably frustrated like we are. Right now, there are close to 100 vacancies at Laguna Honda, and part of that is, the same as General Hospital and the rest of the city. We have thousands of vacancies all through the city. So some of that is not related to the recertification or anything that's happening. It's just we're having staffing issues overall. So because we have those open positions that are vacant, there are no plans for layoffs despite the reduction in patients. We also have a bunch of plans in place for overtime and for temp, positions that have been filling in because of the vacancies. So there's lots of room, even if, there are even more patients that get moved out than we think, between the vacancies, that we are going to not be looking at layoffs for some time.
Michael Lyon made a comment in
Is
the chat.
there more to the role that labor could be playing in this?
They're playing it. So just make me, if I didn't make that clear, and not only has SEIU been, active in all of this, but the international has deployed all of their lobbying power in Washington, D.C. To pressure Javier Becerra and EMS. So they are doing it.
Thank you, Myrna.
Yeah, one of the things that's, is it okay if I talk?
Yeah.
One of the things that's being brought up, if Laguna Honda continues with this flow project, where using Laguna Honda as a place to shoehorn in patients that can't be taken care of safely there, no matter what happens, we're going to be in the same position again soon. And I haven't heard anyone at SFDPH acting as if they have any insight about this. Have you, Myrna?
Sorry, Teresa, I had a bite in my mouth. No, I have not.
Yeah. Because it seems like CMS, if we want to please CMS, the San Francisco Department of Public Health would do well by giving them some reassurance that they're not going to repeat this exercise of using Laguna Honda so they don't have to create specialized programs for people with dual diagnosis who are disabled.
Okay, so Michael Lyon made a good point that relates to this, and there was an article in today's Chronicle about Alameda County Mental Health Services. It also included the idea that, the state mental hospitals were shut down, and people's healthcare needs are not being met. So shoehorning other patient populations into Laguna Honda could be considered an outgrowth of the overall lack of the capacity of our healthcare system, which could also be addressed by things like single payer. But that, I know that's thinking down the road and we're dealing with an immediate issue, but it's something to keep in mind that we're not taking care of each other because we haven't thrown the corporatists out of our healthcare system as single payer would do.
But on a local level, the Department of Public Health could say, we're going to create a program for these people because they don't belong at Laguna Honda, but they need care.
Right.
And I don't hear that.
We're at about 7:30 now. Terry, do you want to extend the meeting or do you want to wrap it up? Or?
Stay. I don't know if everyone can stay, but if other people want to talk or brainstorm, whatever, I think there'll be some emails to follow this. Since you had to register, we have your emails. We can plan another meeting to see how far we've gone if you'd like. There is the July 21st meeting. I just got a call from a member of the Health Commission who has my number, who encouraged people to attend the next Health Commission meeting, which is Tuesdays at 4, and speak at general comment. I think one of the things we have to do is say that we don't want people discharged at a threat to their lives. We want them to stay at Laguna Honda, and we want the funding extended.
I have to go. I'm really not feeling very well. I thank you all very much.
Thank you for speaking.
Thank you, Pat.
Thank you very
Bye.
much. And Joseph, send me your
Thank you.
petition, okay?
Hopefully we will see you all at the GAO meeting on the 21st as well.
Oh, great.
Possibly at the Health Commission meeting, which I think is next Tuesday at 4, but we'll put that in your email.
All right. Maybe we can pick at Laguna Honda too and pass out.
Any public pressure to keep Laguna Honda open, I think, is good.
Okay.
And to keep Laguna Honda funded through December.
Michael Lyon has his hand raised, and I want to also ask you, Michael, if you'll save the transcript for me. I have to get off, but I'll let Terry, I'm going to leave you as
Okay.
co-host. And Michael, please save the transcript for me. And
Sure.
save the chat.
I
Go
was
ahead,
just-
Michael.
I was just going to say, I think we need to join the Laguna Honda crisis with the crisis of homelessness and the crisis of mental illness. I mean, they're all crashing together as problems, but we're not joining in order to fight that. It's just this huge case of the chickens coming home to roost, causing each of these crises.
The trouble is there's incremental reforms and systemic reforms. Anything we do about incremental is Laguna Honda is going to be incremental, but it will affect our lives in San Francisco and many lives in San Francisco. And so I think it's worth doing.